Last month, a perfectly healthy woman in her 60s walked into a clinic for her annual checkup. She left with a heart full of fear and a diagnosis that turned her life upside down: thyroid disease. Her blood results showed dangerously abnormal hormone levels. But here's the twist. Her thyroid was perfectly fine. The real culprit was sitting on her bathroom shelf, a bottle of hair and nail vitamins loaded with biotin. Her blood test didn't lie, but it also didn't tell the truth. And this happens far more often than most people realize. Every day, thousands of seniors receive confusing, even frightening lab reports, not because their bodies are unhealthy, but because their medications and supplements fooled the test. If you're over 50, there's a high chance you take something every day. Maybe a blood pressure pill, some vitamins, a supplement for your joints, or something for sleep. Each of those can change the way your blood looks to a lab machine. According to research from Johns Hopkins in 2023, nearly 40% of inaccurate blood test results were caused by how patients prepared or didn't prepare in the 48 hours before their test. That means almost half of the people getting scary or confusing results might simply be victims of avoidable interference. Your blood tells the truth about your health, but only if you let it speak clearly. And that starts by knowing which substances silence or distort its voice. Biotin, also known as vitamin B7, has become a household name for hair growth, skin repair, and nail strength. Millions take it daily, believing it's harmless. But in the world of blood analysis, biotin is a troublemaker. Here's the science. Many modern lab machines use what's called a biotin streptavidin system. Think of it like tiny molecular hooks that grab onto your hormones or proteins so the machine can measure them. But when you have too much biotin floating in your bloodstream, those hooks get jammed. The machine gets confused and reports false highs or false lows in dozens of tests. The same vitamin that strengthens your nails can sabotage your results. A 2022 Mayo Clinic study revealed that biotin can distort more than 40 different tests, including thyroid hormones, vitamin D, and even cardiac markers that detect heart attacks. One woman nearly started lifelong thyroid medication because her disease was just biotin interference. A patient named Carla, a 58-year-old yoga instructor, took biotin for months. She felt great, looked great, and decided to do a routine checkup. When her results came back, her doctor looked alarmed. Her thyroid hormone levels were through the roof. She was referred to an endocrinologist, who immediately prepared to start her on anti-thyroid drugs. But a second test, taken after she stopped her biotin supplement for 3 days, came back completely normal. No disease, no medication needed, just a powerful lesson. She almost became a lifelong patient for a disease she didn't have. Stories like hers remind us that even natural products can carry invisible risks when we don't know how they interact with modern diagnostics. Biotin isn't the only suspect. High doses of vitamin C can throw off glucose readings, making you look pre-diabetic when you're not. Aspirin and ibuprofen can affect platelet and clotting tests for up to a week. Even certain herbal remedies, like ginkgo or garlic extract, can increase bleeding time. Even the harmless things in your kitchen can blur your medical picture. And if you use fish oil, it can affect triglyceride and liver enzyme readings. The solution? Be transparent. Your doctor isn't there to judge what you take, only to interpret your results accurately. But they can only do that if they have the full picture. Many seniors assume doctors already know everything about their health, but in reality, physicians often rely on what you disclose. A recent survey by the American Medical Association found that over 60% of patients forget to mention at least one supplement they're taking. Sometimes it's because they think it's just vitamins. Other times, they feel it's not worth mentioning. But even over-the-counter products can alter serious diagnostic markers. Your doctor can only interpret what you tell them. Imagine how easily miscommunication can lead to misdiagnosis. One missing detail could mean the difference between your liver looks inflamed and your supplements are interfering. Let's simplify this science. When you get your blood drawn, the lab uses chemical reactions to measure what's inside. Some of those reactions use ingredients like biotin or enzymes that detect hormones, proteins, or vitamins. If you've taken supplements containing those same substances, your blood becomes noisy. The test can't tell which signals are yours and which come from the supplement. Your blood test is like a photograph, and supplements can smudge the lens. That's why even the most advanced machines in world-class labs can still give incorrect results if you're not properly prepared. So how do you make sure your next test tells the truth? Start by thinking of it as a small performance. The blood draw is your moment under the spotlight, but the rehearsal begins 2 to 3 days earlier. Avoid taking unnecessary supplements 48 to 72 hours before the test. Keep your meals simple and consistent. Drink water normally. Avoid alcohol, which can affect enzymes for up to 72 hours. Give your body a clean stage so your blood can perform honestly. You don't need to be perfect. You just need to be aware. Awareness is what separates data from confusion. Picture this. You do everything right. You eat well, you exercise, you rest, and yet your test results come back alarming. Your doctor starts you on medication you don't need, your insurance increases your premiums, and suddenly your confidence in your health disappears. All of that from one unprepared morning. Bad data leads to bad decisions. But the opposite is also true. When you prepare properly, your test results become a reliable roadmap for your future health. You save yourself stress, money, and unnecessary medication. For seniors, the stakes are even higher. Doctors often monitor small changes, just a few points, in cholesterol, thyroid, or blood sugar levels to adjust treatment. In older adults, even small lab changes can lead to big treatment shifts. If your numbers are off by 20% because of a supplement or timing issue, your doctor might change your medication dose unnecessarily. That's why clinics now recommend a medication disclosure checklist before blood work. A simple sheet listing everything you take, from prescription drugs to herbal teas. It's one of the easiest ways to protect yourself from medical confusion. Many people worry that stopping a vitamin for 2 or 3 days will cause deficiency or harm. But that's not true. Vitamins like biotin or vitamin C stay in your system for days, sometimes weeks. Missing a dose or two doesn't undo their long-term benefits. Pausing is not quitting. It's just making room for accuracy. In fact, the only time you should not stop a medication is when it's essential, like heart medicine, thyroid hormone, or insulin. In those cases, your doctor may schedule your test at a specific time after your dose rather than before. It's not about stopping. It's about timing and communication. When booking your appointment, mention that you take supplements. Ask if you need to stop anything before your test. If your doctor isn't sure, your local lab can often advise on which compounds interfere with which tests. Never assume they already know. Assume they need to know. Bring the actual bottles with you or snap photos of the labels. Write down dosage, brand, and timing. A few minutes of preparation can save weeks of confusion later. After her false thyroid scare, Carla decided to track her habits before every test. She noted her meals, supplements, and stress level. Over time, her doctor began to see consistent, accurate results. Health isn't just what your numbers say. It's how well you understand them. She learned that taking control of your health doesn't mean controlling everything. It means controlling what you can. And preparation is one of those things. Your blood tests aren't just numbers on a screen. They are snapshots of your life. What you eat, how you move, how you rest, and yes, what you take. Your blood tells a story. Make sure it's the real one. When you take a few moments to prepare, you're not just improving your lab accuracy, you're reclaiming ownership over your health journey. So next time you schedule your test, do it with confidence. Write down your medications, pause unnecessary supplements, stay hydrated, and walk in knowing you've done your part. The rest is just data, honest, accurate, and truly yours.